So I get a phone call this morning from one of the PAs at our local emergency room. He's like, I am trying to get a hold of one of your partners. She's on call. And I'm like, okay, so like, what's up? She's probably busy. Like, how can I help? I'm on vacation, but whatever. Let's talk about it. So he stops texting. He calls me. He's like, a really bad situation going on in the PTR. What is it? 2-year-old who was bit by a dog and she's lost a lot of her lip. It's really bad. Okay, send me like an unidentifiable photograph. So he does. At least half of her top lip is gone. So I call him back, and her puppy, family's dog, the dog's vaccinated. He's like, what are we supposed to do with this? This is like a community hospital. So everyone's like flipping out. I trained at a trauma center, and I know what the answer is. So it's like contaminated. It's a big open wound. Kid needs antibiotics and he needs the infection to drain out before any normal reconstruction's done. She can't really say that to the parents of this child in this very traumatic situation. We have to transfer the patient out. Have I seen this procedure done in residency? Yes. Do I have privileges at a hospital where I can perform the necessary procedures? Yes. Am I eligible to do this? Did I physically do this procedure? Yes. Would I, at this stage of my career and my current experience, ever do this procedure? Absolutely not. I have probably seen 3 of these in my training, 3 being generous, and this needs to be done at a very specialized hospital. This is what an Abbe flap looks like. This is the procedure that's going to need to be done to reconstruct this 2-year-old's lip and her face. So I called back the PA in the ER and I said, the patient needs to be transferred to a higher level of care. And he was like, okay, well, look, are you and your partner going to come in and have this conversation? I'm not here. She can come in. It's going to be a few hours, but like in the interest of the family, we're not going to take care of this child. I said, my honest recommendation is to transfer this patient to a place like CHOP, NYU. There's a massive pediatric surgery infrastructure almost to treat this within the spectrum of craniofacial, cleft lip, etc., because there's going to be multiple issues to go on throughout the years and they should be plugged into a very specialized system. So I give my recommendation to the PA and he starts sighing and I start sighing. He sighs and he says, I mean, I hear you, but I have to refer within the system. And I said to him, I said, I'm happy to talk to the family on the phone because if this was my child or if this was your child, my recommendation would be to send this patient and the family to 1 or 2 places in the tri-state area. And he's, yeah, no, I know, but this becomes dicey politically because the patient came into the system and we want to keep the patient in the system, even though there are no employed physicians in the system that I confidently know of who can take care of this. So I was like, okay, I would like to talk to them on the phone. And he was, I can't have you make that recommendation. I said, okay, I mean, that's my recommendation. I can document that that's my recommendation, but you can do whatever you want because you're employed by a hospital system. I then talked to my partners. Everyone agrees. We're all on the same page. This is the best option for the patient. I check in with the PA 3 hours later and I was like, I just want to check in and see what's going on. And he was like, yeah, I reached out to the regional center. They evaluated the patient remotely as well. And they agree to send the patient to the higher level of care outside the system. So thankfully that patient is on their way to CHOP to get the care they need. Actually, CHOP's coming to pick them up. The lesson here is a medical opinion is a medical opinion. We are oftentimes as healthcare providers handicapped in our ability to provide the care that we wish we could provide and the information we wish you could give. It is ultimately up to the patient and the family to do what's right for them. But I always have the philosophy that I would treat everybody as if they were a family member and give my honest best opinion, even if it does not comply with the standards or the system. But I believe she will be okay. I'm curious how you guys would handle this.